A major breakthrough in the world of medicine. The FDA recently approved the first treatment to delay the onset of type 1 diabetes. Dr. Mark Guido is an endocrinologist with Novant Health. He says the antibody marketed under the brand name Tzield slows down the destruction of the pancreas.
It kind of helps put the brakes on the body's destruction of the part of the pancreas that makes insulin. It can help slow down the progression to full-blown type 1 diabetes for about 2 years. Does not prevent it, but it can help prevent it from developing.
Type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin. The disease, typically developed in adolescence, can impact anyone at any age. If left untreated, it can lead to heart disease, kidney failure, and even death.
This is probably the biggest breakthrough in type 1 diabetes since insulin itself was discovered. Between 100 years ago and now, really the only treatments we have been insulin. And so it's definitely a first step towards hopefully a brighter future.
Tzield is approved for the use in people 8 and older. Dr. Guido says the treatment is indicated for patients who seem to have a high risk of type 1 diabetes. So these are patients who have a close family member with type 1 diabetes, such as a sibling, a parent, or a child. It just kind of blew my mind when he says it's been nearly 100 years since something this major has been in play for people who are diabetic.
Yeah, just going back to his soundbite, this is probably the biggest breakthrough in type 1 diabetes since insulin itself was discovered.
Yeah.
I mean, that is a big statement.
Absolutely.
That's huge. I just recently was diagnosed pre-diabetic, so I had to start making some changes in eating and exercising and that type of thing because all my friends that have gone down that route have said you want to avoid it at all costs. But thank goodness there are breakthroughs now, because for a while there was nothing really you could do except insulin, and there was not much help.
One of the great things about this, as we know, Dr. Guido was saying, food drives us. We see grocery stores, we see fast food restaurants everywhere that we go, but someone who does have type 1 diabetes, they have to monitor what they eat, the way that they eat. And this treatment doesn't prevent the diabetes, it just delays the onset of it. So you can get a few extra years without having to monitor everything that you eat, checking your sugars, things of that nature.
Now they have one you can put on your arm, it sticks, but there's a little tiny little needle, and it sticks and stays, and you scan it with your cell phone. Like it keeps track of you 24/7.
Yeah, I've seen that. I've actually read about that.
So how did going back to what you were saying, how did they know that you were
Pre-diabetic?
Yeah.
I had no clue, there was no real symptoms. But I went to one of these life screenings where they do a bunch of screenings. It's like a deal. It's like $200, but you get all these things you wouldn't normally get. And they said, hey, did you know your A1C levels are higher? And I said, no, I had no clue. And so they said, yeah, you're not diabetic yet, but you're on the cusp. So if you eat right, exercise, change your lifestyle, you can actually stop it from happening. There is something, my mother had age onset diabetes, but that's a whole different thing. But yeah, so I got to watch carbs and sugars and all of it.
I've had some family members who've had were pre-diabetic, and they cut out juices and lots of sugary drinks. I know with the type 1, he was saying usually when they get screened to see if they can get this treatment, your pancreas has already had some type of destruction in play or starting to work. So this kind of like slows it down, and you didn't know.
All right, so some encouraging news today.
That's right.